And Felice, I'd like to turn to you and hear a little bit more about what brought you to this issue, and also now in your role at the World Bank. You know, a lot of what we are talking about is innovation and activity that is in the US, but also we've underscored the importance of international collaboration and understanding how can these advancements be translated, and also how can access be increased in other countries around the world that don't have as developed infrastructure systems, healthcare systems, et cetera. So I'm wondering, you know, in your experience and also as you're hearing the conversation this morning, what is front of mind for you?
Thank you, Allison, and thank you to Foreign Policy for convening us and organizing today's conference and facilitating this conversation. I just want to take it for 1 second to the human level. How many of you here have had cancer or a cancer survivor or currently a cancer patient? How many here have been a caregiver or a family member for someone in your immediate family directly impacted by cancer? I think pretty much all the hands are going to go up. And so this is really personal, I think, to a lot of us. And I can't agree more with the congressman as he was talking about it. This should be something that unites us all. And what drove me to take action in this space was almost about 10 years ago, my mother was diagnosed with pancreatic cancer, which, as for those of you who know a little bit about pancreatic cancer, is basically a death sentence. And she was a young mom who had become a young grandma to my kids, incredibly active, no prior history. And it shook us at our core that this disease could basically give her a death sentence, and that everywhere we went, the options were incredibly limited. I had worked previously in the Obama White House, but at this point I was outside of government. Similar to the congressman, I was in the private sector, working in technology, but nothing having to do with cancer. And at an event where I was invited back to DC, I had a chance to speak with then Vice President Biden about his experience with his son, Beau. And it was literally months after Beau had passed away from brain cancer. And when I shared with him what we were going through, being this incredibly empathetic person that he is, he pulled my wife and I aside, brought his wife, Dr. Biden, in, sat us down, asked how we were doing, asked how my mom was doing, asked if he could call her to lift up her spirits. She missed the phone call, but she got the voicemail, and she'd go back to it again and again. And then he asked if there was anything he could do. And at that point, he had access to the medical expertise and cutting-edge technology and treatments that only really him and the president probably had access to. And he facilitated introductions and connections to those doctors. You do that for my family, I'm indebted for the rest of your life. That's just the way I am. Unfortunately, it was just too late. It was too late, and the cancer had already taken hold. After what was brutal surgeries and therapies that would only be called by any other name, torture and poison, but was the best that we had. And when he said he was going to dedicate himself to this crazy idea to try and end cancer as we know it, and said that if we could take a whole government approach, really a whole society approach, to do something as ambitious as put a man on the moon and almost touch the face of God, then why couldn't we do that to try and cure this disease and other diseases? And I called him up right afterwards. I said, I have no idea how I can help. That's not my background, that's not my expertise, but I'm all in. And so I was able, very fortunately, to get involved in the first cancer moonshot from the outside of government, and then later on when he left the office and started the Biden Foundation and launched the Biden Cancer Initiative, serve as an advisor. But that's kind of where I come from it, and where, you know, what my life experience that drove me to take action in this space. Since then, I now serve as the U.S. government's representative on the board of the World Bank, and I have been able to better appreciate the incredible access to technology and cutting-edge treatments that we have in this country. And the importance of us trying to address and bridge the gaps, especially in lower middle-income countries around the world. And what I've been impressed to learn about is how the World Bank is really embedding access to care and a digital in-health first strategy in its health programs. And I think you're going to speak to one of my colleagues a little bit later just about that, and I'll leave it to him to kind of address that. But I think when it comes to the technology, and specifically AI and other innovations, tying it back to the cancer moonshot and the global focus that it's had since the very beginning, it's about also leveraging tech that otherwise we wouldn't probably have used in this space to be able to detect early detection, prevention, and also to lower the cost of care.